Hello everyone, welcome back to the C Morning Show right here on C. Today in the first discussion of the day, we will delve deeper into an inspiring story from our guest right here in the studio. But before that, we believe that everyone deserves quality healthcare in order to become a fit and productive individuals, especially right here in our nation. However, not everybody can get access to a proper healthcare due to financial challenges and being the location that is difficult to reach.
Yes, and this issue makes our guest has taken it upon himself to bridge the gap between those in need and those willing to help by creating a medical crowdfunding platform. This initiative is transforming lives, making it possible for underserved patients to access vital healthcare. And to know more about his efforts, we're joined here with WeCare.id founder and executive director, Gigih Septianto. Good morning.
Good morning. Thanks
Welcome to our studio.
My pleasure.
Okay, let's talk about WeCare.id. So it's a platform, it's a web-based or it's a application?
Both. We have mobile and web applications for people to raise funds for their medical needs.
Okay, so what inspired you to create a medical crowdfunding platform? Since we know that you've been starting this WeCare since
we launched in 2015. I worked full time then in 2017, I guess.
Exactly.
Yeah. It's been like
those days, I don't know. People are more aware about the electronic or access it online. Not yet, right? How you started, and is there any personal experience?
Yeah. So I think I started WeCare. I think because like I was inspired by both of my parents. Like I was raised like in a medical family. And I saw them like building small clinics during my teenagers time. And like every night, because like the first small clinic, one of the bedrooms was like just nearby my room, my bedroom. So every single night I heard like people screaming, patients screaming for pain. And I realized that, even like these small clinics in the small village can help a lot. Like it can give people a second chance to live. It can heal people. So I think, and fast forward 2015, 2014, the BPJS is still not really well established as of now. So there's still a lot of gaps in the medical expertise and medical infrastructures in Indonesia. For people who are like in the outside of Java Islands, for example, they still need to be referred to like bigger hospitals to like receive better treatments. And most of them cannot afford for the accommodations, transportations, and a lot of things that BPJS cannot cover. So that's where we are trying to bridge the gap to provide them with additional funding so that they can access medical facilities, better expertise, better facilities in a way that is they deserve that.
Okay.
Definitely. I think it's everyone's right to have great healthcare, right?
And optimal experience of life. And it starts with good health.
Yes, and we know Indonesia, we're made with many traditions, and I think for people that is in the rural areas or the outer skirts of Indonesia, I think they're still believe in someone like traditions or herb traditions as opposed for you going to like a medical.
I think we also still have to respect that.
Of course. But there are some, some treatment that needs to be done, especially if it's in a dire situation in regards to the patient itself. Now let's dissect more of the WeCare.id. Can you tell us more of what actually your platform offers and how easy is it to be accessible for those patients and those in needs?
So I think it's a crowdfunding platform. So I think everyone's in Indonesia at this point of time very familiar with the crowdfunding platform. So we offer crowdfunding services in mobile app and web services for people to raise funds for their medical needs. So people can submit themselves by submitting in our online web platforms, or you can also be supported by our medical partners, which is like the hospitals or also the medical professionals who can assist them because like so many people not really, because like when they are in the hospitals, they don't have time to like putting themselves in the online form. So I think it's very important to have the hospitals administrative staffs to assist to submit the campaigns in our website. And then we will help them to fundraise in our platforms. And then the donors at the other side can start donating from like 1,000 rupiah. So it's very simple, pretty straightforward. We can also help them to optimize the campaign so that it increases the chances for the campaigns to be fully funded. Yeah.
Wow.
Yeah.
So it's like you have your own assistance while you
Yes.
are not feeling well or you are hospitalized.
Yeah. It's a safety
But
net.
It's safety net,
Yeah.
and then you know that you are feeling safe because someone's take care of you.
Yeah.
Basically, something like that.
Yeah,
So,
yeah,
is there any particular health issues that this platform offer to take care, or is there any specific criteria for the patients?
I think we open for all, especially for those in emergency situations, and we are open for patients who have this like the gap between their monthly income or their income with the healthcare spendings that they need to spend. Because like if the gap is too high, then we can justify that they need additional fundings to like to receive good treatments and for their life. Yeah.
Well, I mean, let's say they already started their campaign through
Yeah.
WeCare.id, and then the campaign has not fully met yet
with
the amount of the procedures. What do you do after that?
So we have these ideas called universal fund.
Okay.
So it's like unrestricted funds. So people that donate, the donors can like donate for not the specific patients,
Yes.
but like a pool of funds. So when there's the patients who need like just a little bit more, and like we know that this little bit more money, but more funds will impact significantly to these patients. So we can direct channel the universal fund to these patients.
And also the funders would also know, let's say we're doing, we're funding.
Even like the funds that we move to these specific patients, the donors can know.
Okay.
Yeah.
So they know very transparent.
Yeah. It's like
all the money
funding.
flowing.
Yes.
Yeah. It's like a blockchain, but it's not really blockchain. But like people can trace their money in our platform, like where they go, if it's a specific patients or specific programs, for example.
Okay.
Yeah.
So, how about the progress about the care treatment, health treatment? How could we know that the treatment are being successful?
Yeah. That's we also dependent on the patients to update their campaigns, because like there are so many patients and our staffs are like not so many. So we hope that patients, after we disperse the fund, they should be able to to report the transparency.
Right, and
so
you're also, you're also close with the hospitals or any medicals treatments also. In regards to that though, I also want to ask, were there any challenges, by, facing through this platform? Because I guess trust is number one key.
Yeah.
What other challenges that you met maybe back then that you've already succeeded now?
Yeah. It's not really succeeding, but like, we're kind of...
Well, I mean, you're almost 10 years, yes.
I think first is scaling up. Even though like we are now have people who use like mobile apps, something like that, but still very, like Indonesia 280 million. But for those like already used to like online donation, maybe it's still 10 to 20 million. So how we can break through that numbers, I think that's also challenging. And I think after COVID, like the fluctuating economic situations, people are not really giving much or spending as much as it was before 2020. So I think that's caused a little bit of like fluctuating tractions in our platform as well. I think that's a challenge. Yeah.
So, Gigih, since you are working with the healthcare industry, and then to be specific to take care of someone who gets sick, and then to get right treatment by doing a crowdfunding. I don't know. I'm wondering why people have to, like people who feeling not well, need a treatment, should go to WeCare. And what is your opinion about our healthcare systems?
Okay, it's pretty good actually. I mean, like compared to, like now we have national insurance, BPJS, I think the enrollment rate of BPJS right now is much better than when we started in 2015, 2016, still new. It was still new and not many people are enrolled in the program. Now we have like most of the people maybe have BPJS right now, but we have still this like a lot of people actually, like for example like informal workers and other people who cannot still not be able to afford the premium for the BPJS. So I think that's where the safety net or like the additional alternative funding still be needed. And of course for the like additional funding, for example, for the transportation accommodations, like for example in Eastern Indonesia, when there are a lot of islands.
Like a remote
remote areas, like it's very hard to go to the primary hospitals. They go have to have like a ship, they use boats, like when
the infrastructure
is so bad. We went there a lot, and like how can like
Yeah.
we cannot relate. Like, people in Jakarta will not be able to
Yeah.
relate that this kind of condition still happening.
It's like you bringing the spirit of gotong royong.
Yeah.
That's very Indonesia.
That is
Unity,
Yeah.
diversity.
Yeah.
In regards
We're
to
the
that-
most generous country in the world
Yeah.
for 7th time.
And
Isn't
even
it amazing?
ourselves, right?
Yeah.
Within ourselves. But in regards to this, so with the WeCare.id, how
Yeah.
can you put, let's say, there's 10 people that
Yeah.
needs the help, that needs the campaign. But of course, and within all this 10 different situation is very different. There's
Yeah,
the one
yeah.
that maybe
Yeah.
could, take more longer time. Then there's the one that needs to have
Yeah.
an access of a treatment right away.
Yeah.
How can you assess which one goes first, especially with this crowdfunding?
Yeah. That's always a dilemma within us. Like maybe not so ethical, but like sometimes we also have to match it with the market as well. Because like sometimes the donors they need stories. So perhaps for the campaigns to be successful, sometimes we also need the patient to have like a good stories. So even though like it's so emergency, but if you cannot provide good stories, then the little small chance we can get you some donors. So I think we also prioritize patients who are cooperating with us in order to like, can we have this angle of the stories? Can you submit better photos, something like that? So we also prioritize that as well for people who can. There's something work that they need to that needs to be done by themselves.
But do they know that things like that are part of the?
We suggest them. We ask them. Ask them for
because
requests.
if they know, they will just submit it. Everything.
Blue
without
photo,
exactly.
and like there's like one sentence stories, but like it's not interesting at
Also,
all.
are there challenges
Yeah.
for people that still, I think, very kind of taboo for them to share their situation, especially we're living in this country where some stories are meant to be for themselves or their family and they don't want to share what is happening.
Yeah, sometimes it happens. Like there is patients who I think we think that they need some help to raise fund, but they decided to not to because of the taboo.
And the
The,
conditions, right?
they don't want to be exposed. They don't
Correct.
want to. It's happening. Yeah.
Wow. So basically, there's a lot of challenge, not
Yeah,
from
a
the
lot.
WeCare itself,
Yeah, but also for the
system, and also from the
for the
outside.
patient- for the people who want
Exactly.
we
Who
want
wants
to help.
to get help,
Yeah.
right? So, is there any part that you are collaborate with WeCare to make this journey or this that you done be successful or even bigger to reach bigger goals?
Yeah. I think the best way is to work with the government and the hospital itself, because sometimes we should normalize crowdfunding. Sometimes the hospitals also be confused because these patients can it because there is BPJS already, and sometimes they are afraid whether this patient can be paid using BPJS or crowdfunding. So I think normalizing crowdfunding by having the hospitals promoting it, I think will be very good. For the
You
patients.
were also mentioning this is not only for those, let's say, that is very underprivileged or the one that's living on the outskirts of Indonesia, but you were saying it applies for everyone that needed, the help.
Because if you need expensive spending for healthcare, maybe you are well off economically if you do it.
But
But like
still.
if you have like a lot of bills, like medical
Exactly.
bills,
Especially
you can
for
go poor.
critical illness,
Yes.
right?
Critical illness. So that's why you
Yes.
need like the safety net either for
Yeah.
insurance or from platform like this. Like philanthropical
Wow.
approach is very huge in Indonesia.
And also supporting
Yeah.
system.
Yeah,
right?
supporting system. Yeah.
Thank you so much for your initiative, Mas Gigih. Definitely now WeCare.id is almost going to 10 years.
Yeah, almost.
In a couple of months, we're
we'll
shifting to
see.
2025.
Yeah.
We know you've already been here for a decade with
Yeah,
WeCare.id.
yeah.
What is your short plan and also your long plans, especially for WeCare.id?
Yeah, I think we will stay true to our missions. We want to make sure that everyone can have like a better quality of life, have safety nets, and I think that's the innovation that we also want to pursue, continue improving our services, and when we're perhaps expanding to some other services that still align with what we are trying to do.
Wow.
Yes, I mean,
Best of luck.
Thank you.
Yes,
Thank you.
indeed.
We'll see.
We need more people like you.
Hopefully, there are a lot of
and more
Indonesia is very a lot of
to
people are kind.
initiate this kind of things, and I like that
Yeah.
to normalize crowdfunding.
Yes.
Because sometimes we don't know. Sometimes people
raising fund is not taboo. Like fundraising is good. Like we all fundraising all the time, right?
True.
For
Sometimes
social issues, for your
probably-
even like education. For example, we win a scholarship and then we
Yeah.
fundraise for
Exactly,
ourselves.
yeah.
That's fine.
I think we just
Totally
need to
fine.
change the mindset of the
Yeah.
people that is going to be given of that fund, of that fundings, right?
Yeah,
Some
yeah.
people think that maybe I work 9 to 5, I don't need this, but when you see your bills, like I do need help.
Yeah.
So it is not, it is
it's-
okay for
yeah,
you to
it's
get
okay.
from help from others.
Yeah,
Exactly.
yeah,
And
yeah.
because of that, thank you so much for
Thank you so much for
Thank you
having
very
us.
much,
Yeah.
Gigih Septianto here, right, as the founder and also executive of WeCare.id. Definitely, like you were saying, this is a true to our nation's color. We're gotong royong.
Gotong royong.
Unity in diversity, and of
Yes.
course, and we're uniting towards each other and helping each other out. Thank you very much.
Thank you
Mas
very
Gigih,
much.
for your
Yeah.
day. All right, so folks, we're set for another commercial break. When we return, we'll bring you the world headlines. We're here on the C Morning Show. We'll be right back.